This video I'm going to be talking about the medial compartment of the thigh muscles, which are comprised of the Gracilis, pectineus, Adductor Longus, Adductor Brevis, Adductor Magnus, and Obturator externus. I'm going to be discussing its origin, insertion, action, and innervation. And let's get started with the Gracilis muscle. In this slide right here, in this image, we can see that the Gracilis muscle is located in the medial portion compared to the other muscles. And its origin, it's going to be located right here where the pubic bone is. And actually its origin is going to be the inferior pubic ramus. Its insertion, it's going to be, if you look at the bone, if you look at the muscle, it's going to be located right here around the tibial bone. And that portion, it's called the medial surface of the tibia. Simple as that. Its action is going to be adduction of the hip. And its innervation is going to be by the obturator nerve. Most of these muscles are going to have an innervation, which will be done by the obturator nerve, and we'll see a few differences. I'm just going to relocate this. The pectineus muscle, if we take a look at this image, is located right here, which is cut right there, the pectineus. But this is a good image because it shows its origin very clearly. The pectineus is on this image, is right here, and we can see the insertion located right around this area. And so its origin, which is located in the pubic bone, will be actually the pectineal line of the pubic bone or pubis. Its insertion, it's going to be on the femur, and it's going to be at the linea aspera and the lesser trochanter. It's going to have an action of adduction and a flexion of the hip. And this is one of the muscles that are going to be a little bit different in terms of their innervation, because in this one it's actually going to be innervated by the femoral nerve. One of the few differences that is found in this compartment. So after the pectineus, we have the adductor longus. The adductor longus, like how its name says, it's going to be very long. It's going to be initiating right here, and it's going to go all the way and travel to the femur, where it's going to be its insertion. So the origin of the adductor longus is going to be at the body of the pubis. Its insertion is going to be at the linea aspera of the middle third of the femur, or the shaft of the femur. And I'm going to put here, right here, shaft. Its action is going to be very similar, or it's actually going to be the same as the pectineus nerve. So I'm going to put here adduction and flexion of hip. Its innervation is going to be the obturator nerve. Then if we go back and we look at the next muscle, it's going to be Adductor Brevis. The Adductor Brevis, it's going to have a very similar insertion, but this picture kind of is a little, it's not telling the entire truth. This one looks a little bit more obvious because its origin is going to be a little bit behind. And if we take a look where it's actually going to be, it's the inferior pubic ramus, same as the Gracilis. And as mentioned before, it's going to have the same insertion, a similar insertion to the adductor longus, and that's going to be the linea aspera of not middle but proximal third of shaft of femur. Its action is going to be adduction and medial rotation of the hip. Its innervation for the adductor brevis is going to be the obturator nerve. Then we have the adductor magnus. The adductor magnus is going to be having two origins and two insertions. I'm going to separate this because it's going to occupy a little bit more than the usual. And it's going to have an adductor and the hamstring side. On its adductor, if we take a look here, that's the adductor magnus, and we also see here this entire portion. The adductor magnus is going to have the origin of adductor is going to be located at the ischio pubic ramus of pubis, or pubic bone. The hamstring portion is going to have the ischial tuberosity. They're both going to have a different insertion. The adductor is going to have one, the hamstring is going to have one. The adductor is going to be located at the posterior surface of proximal, that's not a P, proximal femur. And its hamstring is going to be having two insertions actually. One is going to be the obturator tubercle and the medial supracondylar line. They're both located at the distal portion or distal end of the femur. They're going to have the same they're going to be inducing the same action as the adductor brevis, which is adduction and medial rotation of the hip. Its innervation is going to be it's going to be a little bit different because they're coming both. Adductor is going to have one and the hamstring is going to have one, and they're not the same because the adductor is going to be innervated by the obturator nerve, whereas the hamstring is going to be innervated by the sciatic nerve. The obturator externus, the last muscle that's going to be found right here on the posterior side, still part of the medial compartment. We can barely see it here on this image. This one's a little bit more clear. And its origin is going to be the obturator membrane. And it's going to have an insertion by the trochanteric fossa, and it's going to induce lateral rotation of the hip as its action. And lastly, it's going to have an innervation by the obturator nerve. I know my writing is not very pleasant to see, but I try to do this the fastest that I could. And those are all the origins, insertions, actions, and innervations of the medial compartment of the thigh muscles. There it is.